This is Channel 9 Eyewitness News at 5:30. Coverage you can count on.
We know many of you are working from home and learning how to operate during the ongoing pandemic concern. We're here on air and online at WFTV.com 24 hours a day, keeping you updated as things develop. And Greg, there are a lot of developments.
Boy, it just seems every afternoon more after more of these major news events. And if you're just joining us, let's get you caught up on what's happened so far. About an hour ago, right here on Channel 9, both Orlando Mayor Buddy Dyer and Orange County Mayor Jerry Demings held a news conference about local impacts of the coronavirus pandemic. They said a large drive-up testing site is expected to be open in the next 48 hours at the Orange County Convention Center. That is huge news. The Orange County Health Department also has plans for a smaller testing site as well soon.
I want our residents to know that this is going to be an uncomfortable period of time that we're going to be living within for the next several weeks, perhaps several months.
Mayor Demings said there are now 9 confirmed cases of the coronavirus in Orange County. That's an increase from yesterday's number of 6.
The insurance provider Medicaid is reminding you that appointments using telemedicine are covered, at least while COVID-19 concerns are active. Well, today we got a look at how that technology is working for an Orlando practice. Channel 9's Angela Jacobs joins us live. Angela, the demand for this option now is increasing every single day.
And Vanessa, we're just going to see more and more of it because it allows patients to connect with a doctor or even a specialist just with their mobile device or their desktop. In fact, at one practice we learned right now there are more than 7,500 patients who are eligible to use telemedicine.
And where's the pain at now since you jammed your finger?
A sprained finger is the diagnosis in this virtual appointment at the Orlando Orthopedic Center.
It's in the middle joint where it's kind of enlarged a little swollen.
From a specialized app, appointments are available every 15 minutes. Patients get a basic assessment from one of the same specialists they'd see if they came in person.
There are some very basic things we can do that save the patients the trip. It's a convenience, and it still provides a valuable service for them.
And do you have any numbness or tingling that goes into the finger at all that I'm not identifying on the computer?
We can do most of the assessment over the video and without having to do like height and weight and blood pressure, because those things typically don't apply to knee pain or back pain.
Right now, the clinic has rolled out the tech on a limited basis, but hopes by next week to expand across all 40 providers. Just a sign of the times, says Joyce, who calls COVID-19 the catalyst to move telemedicine forward.
The demand on the public levels is increasing, and also the demand now on the provider level to have these different solutions available. I think this will be the thing that will make it now a standard of care at all different levels, and we're just trying to be on the kind of the leading edge of that.
Do you have any questions or concerns?
No, sir.
Excellent.
Now, insurances can vary, of course. So this clinic knows if insurance, or says if insurance doesn't cover its service, it has set a self-pay rate at $50, trying to keep this service affordable and convenient. Live in Orlando, Angela Jacobs, Channel 9 Eyewitness News.
Such an interesting story, and really the wave of not just this instance, but really for our future telemedicine. All right, Angela. The Brevard County Emergency Management Office is closing beachside public parking starting tomorrow to cut down on the amount of people on our beaches, and that includes all county and municipal parks and Patrick Air Force Base. This was a scene on those beaches today. Definitely not packed, but tourists we talked to say they are still enjoying our beautiful weather.
Happy to be out of the weather, but we're concerned with everything that's going on in the country, and we're just keeping our distance, trying to be safe, and we'll probably be headed back in the next day or two and checking out things back in Michigan.
New Smyrna, a different story today. It was at capacity, and they had to shut down the ramps at 5:15. Meantime, Florida Governor Ron DeSantis asking people who visit the beaches to maintain social distancing and avoid crowds of 10 or larger. So again, 6 feet apart and 10 or fewer. The coronavirus pandemic has also taken a toll on our local blood supply. Orange County Mayor Jerry Demings and Mayor Buddy Dyer of Orlando both working with One Blood to help get the word out about the need. They both donated blood today. One Blood has had 1,700 blood drives canceled through May because of the coronavirus, and that puts them way behind by about 25,000 blood donations.
This is for the long haul. This is not a one and done. This is something that has to be done on a regular basis to ensure a ready blood supply for our communities.
One Blood says that they're also practicing social distancing inside of the Big Red Bus and donation centers right now.
Now, speaking of that, self-isolation, social distancing, quarantine, this behavior is not normal for us, as it's essential to connect and relate with each other. But living in a world of self-isolation as we fight the spread of COVID-19 can trigger our anxiety and depression. Channel 9's George Waldenberger reached out to a licensed mental health counselor today to explore how we can stay mentally well. That's very important as we continue to distance ourselves.
Some anxiety is healthy, as it can be an emotional signal to point us to what in our life needs fixing.
But when there's too much unproductive anxiety, such as rumination or excessive worry about things we can't control, that tends to interfere with functioning.
And in a world of forced self-isolation and social distancing under COVID-19, mental health impacts can snowball.
A rise in things such as substance abuse and addictions as people increasingly turn to these types of coping mechanisms as they're isolated. And I think that potentially there could be a higher rate of suicidality.
Colette advises to limit how much you engage in all the information coming in and avoid it if it's unreliable information. Stay grounded to ward off negative emotions of others. And if you know someone living with depression or anxiety, reach out. Stay connected, even if you physically cannot.
There are a number of resources, community resources such as 211 that you can call in a non-emergency situation and find out what resources there are in your local community.
Her biggest advice, when in doubt, do something kind for someone else. It will make you feel better than almost anything else a counselor can suggest. George Waldenberger, Channel 9 Eyewitness News.
And the counselors say it's important to remember reactions to self-isolation will be different for everyone, and emotions can be even more contagious than COVID-19. Respond to one another, they say, and take care of each other if you're in close confinement. Avoid being short and taking your frustrations out on others.
The good, that's something that we all like, that contagious part. Thank you, Vanessa. There is some confusion over coronavirus test kits as well tonight. Some experts are asking why the U.S. didn't use test kits already made by the World Health Organization, but the CDC was never offered those tests or even discussed. A WHO spokesman says the U.S. usually uses its own testing. The WHO sent out 250,000 test kits around the world just a day before the CDC said it would ship kits around the U.S. But those kits were faulty and then had to be remade.
In Washington, members of Congress are also dealing with a new normal thanks to the virus. On the Senate floor, senators have been asked not to meet or talk in groups. They're encouraged to vote and then leave. Most members of Congress usually go home on the weekends, but some say they're staying put.
Once Washington got identified as more of a hot spot than New Hampshire, and once we knew there was a positive case among congressional staff, I made the decision not to come home because I have a family member who has a highly compromised respiratory system.
Many members of the House are also meeting online. Detroit's major automakers are closing their factories temporarily due to fears over the coronavirus. Ford says its plants will shut down after tomorrow's evening shifts. General Motors says it'll start a systematic, orderly suspension of production through the end of the month. After that, operations will be evaluated weekly. And then Fiat Chrysler has already closed a factory near Detroit. Honda will also close its North American facilities for a week starting Monday. The move will affect at least 150,000 workers.
Right now, COVID-19 testing is going on in Marion County at 2 sites, one in Ocala, the other in the Villages. Channel 9's Jeff Lefkulich has shown us the drive-through testing going on at Premier Medical Associates in Ocala today, and also who can get the test.
And you must have an appointment to come here to get tested for COVID-19. You can see you just drive up here and medical professionals will come out and swab you. A big sign greets people at the door outside Premier Medical Associates in Ocala. Do not enter if you have any of these symptoms related to the coronavirus. Since Monday, a makeshift drive-thru has been set up in the back of the building to test people for COVID-19. They have a similar setup at their location in the Villages. The first step, if you think you have it, you must first schedule a telemedicine visit with a doctor.
Go through a process. They get an appointment with the doctor, and then the doctor will schedule the testing part. Then they're going to go to one of our sites. They're going to drive through, get the swab, and leave.
Once they leave, they must quarantine for the next 14 days. The results of the tests take 72 hours to determine if they are positive or negative.
We're extremely concerned about the senior population. They are in need of us taking care of them. They're high risk than a younger population, so we wanna get to them. We want to let them know that we're here to help.
Premier Medical Associates takes all insurance. You don't have to be an existing patient. Supplies of the COVID-19 tests are limited, though.
Supplies are limited. The government is working diligently to make more. We're expecting to have more in the next couple of days. But meantime, we have to care about the other person. It's about the urgency.
And Premier Medical Associates hopes to open 2 more testing sites, one in Orange County and one in Osceola County next week. In Ocala, Jeff Lefkoolitz, Channel 9 Eyewitness News.
Those testing sites been a big issue. Up next.